A great day to all. Again, this is your professor, Dr. Cabrera, and I'll be talking about three organisms, here, the Mycoplasma, the Chlamydia, and Rickettsia. All based on the rapid review, okay, manual, okay. So let's talk about Mycoplasma. Mycoplasma is an organism that has no cell wall. It's otherwise called your walking pneumonia. It is the smallest free-living bacteria that lacks peptidoglycan, that's why it doesn't have a cell wall. It is the only bacteria with sterols in their cell membrane, which are usually acquired from the host, and the virulence factors are from your P1 adenosine, which mediates adherence to respiratory epithelium. It has cytolytic enzymes, superantigen stimulation to form cytokine storm. Your Mycoplasma pneumonia causes mild, hard-to-resolve respiratory infections. And, fortunately, it only infects humans. The Mycoplasma infection spreads via aerosols from infected in person and even from asymptomatic carriers. So it is typically called your atypical walking pneumonia. Because why? This type of pneumonia, when seen in the chest x-ray, will show interstitial, okay, pneumonia. In this type of pneumonia, though it is bacterial, it manifests like a viral pneumonia. It has no alveolar exudate, but differs clinically from your typical community-acquired pneumonia caused by your streptococcus. And even the signs and symptoms, the clinical signs and symptoms of this disease is quite atypical. It may look like a viral infection because initially it has malaise, low-grade fever. Again, as I have taught you, strep pneumonia the typical ones will manifest high-grade fever. But for a bacterial infection, by dictum will cause high-grade fever, but not with Mycoplasma. It causes low-grade fever. It has headache, is followed after 2 to 4 days of non-productive cough. Then later on PE will appreciate rales and bronchi, and your patient will feel muscle pain. So it may manifest like a flu, okay, and rarely, this is one, it causes an IgM-mediated hemolytic anemia. So among the bacterial infection, this one causes hemolytic anemia in rare situations. So outbreaks are quite common, called your walking pneumonia. In populated areas like your military barracks and okay, this is a very nice slide, very nice table that compares the cause of your typical pneumonia from the cause of your atypical pneumonia. Okay, so it differentiates it by its characteristic. Like the type of pneumonia for Mycoplasma, it is the atypical type because it will manifest as interstitial pneumonia, while your typical streptococcal pneumonia will present with alveolar exudates. In this type of pneumonia, the preceding pharyngitis is common in Mycoplasmal pneumonia, but it is never seen, okay, in pneumococcal pneumonia. The onset for your Mycoplasma pneumonia is slow, it's gradual, while in your pneumococcal pneumonia, it is rapid with chills. So your patient has rigors or chills, fever, Your Mycoplasma pneumonia will manifest as low-grade fever like a viral infection, while your pneumococcal pneumonia will present with high-grade fever. So your typical is high-grade fever with chills. Okay, the cough is non-productive and paroxysmal in your Mycoplasma pneumonia, while in your pneumococcal pneumonia it would be productive. Sputum usually is clear in your Mycoplasma, while it is purulent in your streptococcal pneumonia. Chest pain, pleuritic chest pain is absent with your uh, uh, Mycoplasma pneumonia, while it is present. You have chest pain with your streptococcal pneumonia. Leukocytosis, it doesn't manifest with your Mycoplasma pneumonia, while it manifests or it is present in your streptococcal pneumonia. Age of highest incidence, your Mycoplasma pneumonia is present, is usually seen in young adults, while in your streptococcal pneumonia is usually seen in older adults. Complications, so it has also different complications. For your Mycoplasma pneumonia, it can have otitis media, erythema multiforme, hemolytic anemia, myocarditis, pericarditis, bullous otitis media, while in your streptococcal pneumonia, it has only 3 complications: bacteremia, meningitis, and otitis media. Your mycoplasma can cause tracheobronchitis, wherein there is marked inflammation of the bronchi, which will manifest as non-productive cough, fever, headaches, sore throat, and pharyngeal exudates, and even cervical lymphadenopathy. While it persists with the pharyngitis, okay? Your pharyngitis may precede your pneumonia or constitute milder presentation of your Mycoplasma pneumonia infection. It resembles a non-exudative group A strep or viral pharyngitis. And your Mycoplasma pneumonia is associated with Guillain-Barré syndrome. So again, let us review. Your Mycoplasma pneumonia causes atypical pneumonia, trachobronchitis, and pharyngitis. So it causes ATP, atypical pneumonia, trachobronchitis, and pharyngitis. While your Mycoplasma hominis causes pyelonephritis, pelvic inflammatory disease, and post-abortal fever and postpartum fever. So this is another species of your Mycoplasma. Your Mycoplasma hominis causes pyelonephritis, all P's, pyelonephritis, pelvic inflammatory disease, post-abortal fever, postpartum fever. So it infects the lower part of the. Now let's proceed to another organism, which is your Chlamydia. So this is quite interesting because this is a small obligate means it will need to be inside the cell. Intracellular bacteria existing in 2 forms. Your elementary body, see, your elementary body are the green parts. Those are your elementary bodies, and your reticulate body will be the red parts. Okay, so it is your reticular body and your elementary body and your reticulate body. Okay, your elementary body enters the cell. Okay, smaller extracellular infectious form which are metabolically inert and resistant to harsh conditions. While your reticulate body, the red ones, are the larger intracellular form that is metabolically active and replicates within the cell. So this is your cell. So you have your reticulate body infecting the cell, and you have your inert or inactive elementary body. Okay, and chlamydia cannot make the energy of life. They cannot make ATP, and also they lack peptidoglycan. So it is a cell wall-less organism. They possess a cytoplasmic membrane and an outer membrane but lack peptidoglycan layer, unlike your gram-negative, and thus are insensitive to your beta-lactam antibiotics, just like your Mycoplasma. And chlamydia, since they do not produce their own ATP, gets their ATP from their host, so they are called your energy parasites. Okay, and this is a very good table that compares the different chlamydial species, Chlamydia trachomatis, Chlamydia psittaci, and Chlamydophila pneumoniae. Okay. So as to host, for trachomatis, primarily human. For psittaci, animals are the primary host and humans are occasional host. Your Chlamydophila pneumoniae, okay, so your Chlamydia trachomatis, Chlamydophila psittaci, and Chlamydophila pneumoniae. For pneumoniae, it's humans only. Iodine staining of inclusion body, it's only is your Chlamydia trachomatis. For sulfonamide susceptibility, only your Chlamydia trachomatis is sensitive to sulfonamide. Both your Chlamydophila psittaci and your Chlamydophila pneumoniae are both resistant to sulfonamide. So what are diseases that are caused by the different species? For your Chlamydia trachomatis, it causes trachoma, that's from A to C. From L1 to 3, it causes your lymphogranuloma venereum, okay? And D2K causes sexually transmitted disease, infantile pneumonia, and conjunctivitis. While your Chlamydophila psittaci causes psittacosis, which is otherwise called your parrot fever. Your Chlamydophila pneumonia causes pharyngitis, bronchitis, pneumonia, and sinusitis. So transmission, your Chlamydia trachomatis is sexually transmitted through vertical transmission through the birth canal and contact with body fluids. While your Chlamydophila psittaci is through inhalation of dried bird feces. While your Chlamydophila pneumonia is through aerosol, inhalation of aerosols from infected persons. Okay, so these are causes, infections caused by your Chlamydia trachomatis type D through K. Urogenital infection. In women, it causes cervicitis, urethritis, salpingitis, and your PIDs. In men, it causes urethritis, epididymitis, and proctitis. Systemic infections in women causes arthritis and dermatitis. In men, it causes Reiter syndrome. This is your non-gonococcal urethritis, which presents as a triad: arthritis, urethritis, and uveitis conjunctivitis. That is your Reiter syndrome. It is caused by your Chlamydia trachomatis. Your ocular and neonatal infections, your adult inclusion conjunctivitis, which manifests as mucopurulent discharge, keratitis, inflammation with potential scarring and spread by auto-inoculation or ocular genital contact. While your neonatal conjunctivitis, it will present with swelling of the eyelids, fever or hyperemia, and purine discharge beginning 2 days to 30 days after birth from an infected mother. Okay. Unfortunately, it can present with conjunctival scarring. and corneal vascularization, which when untreated, okay. So the treatment for this condition is topical erythromycin, which is administered routinely to neonates to prevent eye infection. Infant pneumonia, it presents with rhinitis beginning 2 to 3 weeks after birth, followed by distinctive staccato cough, trachomatis. 2 to 3 weeks later on with staccato cough, no fever. Without treatment, infection might develop into diffuse interstitial pneumonia, just like your mycoplasma. So this is a morbid picture of a cervix with purulent and of a penis with discharge. So lymphogranuloma venereum, it is caused by Chlamydia trachomatis types L1 to L3 and is sexually transmitted. That's a sexually transmitted infection or STI. The initial stage of this disease will present as a small painless lesion that appears at the site of the infection 4 to 6 weeks after exposure. It is 1 month to 1.5 months after exposure. And later on, possibly it will have fever, headache, and myalgia. And later on, if untreated, it will cause a painful inflammation and swelling of draining lymph nodes, usually in the inguinal nodes, okay? And these enlarged nodes may rupture, forming draining fistulas and local ulcers. If ever there will be rectal infection, there will be rectal strictures in women and homosexual men. Now this is quite morbid. It is your trachoma. Okay? Your trachoma is known as your chronic keratoconjunctivitis. It is caused by Chlamydia trachomatis A through C. It is spread by tears, contaminated clothing, so by fomites, and hands. This infection is not sexually transmitted. Again, this is very important. Your trachoma caused by your Chlamydia trachomatis is the leading cause of preventable blindness worldwide. This is prevalent in Africa with an early stage as manifest as initial follicular conjunctivitis with diffuse inflammation of the conjunctiva marked by pain, photophobia, and lacrimation. And later on, when untreated, there will be formation of, like this one, at the top, hard red papillae and interning of eyelids leading to corneal abrasions, ulceration, scarring, and blindness. So remember, this is very hard, and this is very hard, and it will be rubbing against the cornea, so it will cause corneal abrasion and later on scarring and blindness. So how do we prevent this condition? By giving topical erythromycin, okay, can prevent neonatal conjunctivitis. Okay. For your infantile conjunctivitis secondary to your Chlamydia trachomatis, okay. So topical erythromycin on eyelids of the newborn prevents trachomatis and Neisseria infection. And of course, for the serotype that causes sexually transmitted infection is to practice safe sex practices and improve personal hygiene can reduce the rate of infection. Again, you also use tetracycline, erythromycins, or fluoroquinolones, okay, to treat your chlamydia infection. Now, your Chlamydophila psittaci causes your parrot fever. Maybe parrot fever may be asymptomatic or manifest with mild flu-like symptoms, may progress to serious interstitial pneumonitis with cyanosis, jaundice, and central nervous system involvement like headache, convulsions, and coma. Transmission occurs via the inhalation of contaminated dried bird feces. Your Chlamydia pneumonia causes your pneumonia, okay? Your Chlamydia pneumonia, your Legionella pneumophila, and your Mycoplasma pneumonia all causes atypical pneumonia. Okay, so these are the causes of your atypical pneumonia, your Chlamydophila pneumoniae, your Legionella pneumophila, and your Mycoplasma pneumoniae. Your Chlamydophila pneumoniae causes respiratory tract infections with manifestations that includes pharyngitis, sinusitis, bronchitis, or pneumonia with persistent cough and malaria. Transmission occurs from person to person through aerosols. And your Chlamydophila pneumophila has a strong association with coronary artery disease. Okay, and the last organism would be your Rickettsia. This is a small gram-negative non-motile pleomorphic bacteria that are obligate intracellular parasites. It is an animal-borne infection. This is a zoonotic disease typically transmitted by insect vectors from various animal reservoirs. It is quite common in the southeastern Atlantic and south central states. It is the vector is a tick, and it manifests your whale Felix reaction. So that's the tick that causes Rickettsia. So incubation period is 7 to 20 days, except for chronic Q fever, which has prolonged incubation period from months to years. The onset is abrupt, except for endemic murine, typhus, and chronic Q fever, and it manifests as fever, chills, headache, myalgia, okay, as the initial symptoms, and there will be characteristic rash will be seen in most Rickettsia diseases. Treatment of such infection would be tetracycline or chloramphenicol. Okay, so this is a table that causes your common rickettsial and related diseases. Okay, Rocky Mountain spotted fever, epidemic typhus, your endemic murine typhus, your rickettsial pox, your Q fever, your ehrlichiosis, and your catch fever. Okay, these are zoonotic infections. And then that's the end of my lecture. So thank you very much for listening. Don't forget to share this video, watch this video fully, and subscribe. Okay, click that thumbs up and that notification, and please share this video, and I'll be making more videos as the days goes by. So keep on learning. Have a great day.